It's extremely important to treat obesity as a disease and to recognize it as a disease, because most commonly it's still considered an adjective. It's a description. It's someone is obese because of some failure on their part. The first step is recognizing it as a disease, much like high blood pressure or cancer, and that really directs our approach to how we treat it. Management of obesity is very complex. Just like any other serious or chronic illness or disease, there's lots of facets, there's lots of ways to approach it. And it has to be a multidisciplinary approach. Whether you choose diet, exercise, medication, or surgery, it should be done at a comprehensive center that offers all approaches, because none of it should be a one-stop shop. Long-term, we have still seen that the most effective long-term management of obesity is surgery. My biggest recommendation if you're considering a GLP-1 is to ask your physician, and ask a qualified physician who understands how the medication works and what are the consequences and side effects, etc., revolving that medication. For the most part, there's designated criteria that you must meet to be a candidate for surgery. So if you're not sure, ask your physician whether you're a candidate for surgery or perhaps a GLP-1 medication would be better for you. A lot of the risks involved with bariatric surgery are the same risks for any surgery that you have. There's a risk to being put to sleep for general anesthesia. There's a risk of bleeding. There's a risk of infection with any operation. Our recent advances in bariatric surgery, especially with robotic surgery and minimally invasive approaches, make it about as risky as a gallbladder surgery, certainly much safer than larger surgeries than it has been in the past. Bariatric surgery is the strongest weapon that we have to fight the disease of obesity. It is one operation, even though it's a lifelong lifestyle change, but it's one operation followed by lifestyle modification and diet, and it's extremely effective. There's plenty of research out there that shows you not only do you lose weight, but more importantly, there's metabolic changes in your body, right? Your high blood pressure gets better, your diabetes gets better, you live longer, your chances of getting pregnant if you're struggling from obesity much higher. Risk of developing several types of cancer plummets after bariatric surgery with the weight loss. The vast majority of operations here in the United States are the sleeve gastrectomy and the gastric bypass. There are other operations that can be discussed, including the duodenal switch and some endoscopic procedures. The sleeve gastrectomy and the gastric bypass are by far the most commonly performed in this area. Acid reflux is probably the single greatest decider should we offer a sleeve versus a gastric bypass, because uncontrolled reflux can be a real problem with the sleeve, whereas a gastric bypass does a great job of addressing acid reflux. With very few exceptions, all of our bariatric procedures here at TMH are performed robotically. That's the sleeve, the gastric bypass, even all of the revisional surgeries, and even duodenal switch, performed robotically here at TMH now. For the most part, that's 4 small incisions. A vast majority of my patients go home the day after surgery, so limited hospital stay, limited recovery. We've eliminated narcotics for the most part for our bariatric program, just because we know the long-term and short-term effects of narcotics. So with updated algorithms for pain and nausea control, our patients have minimal impact on their life as they get a one-day surgery and then go home. So the sleeve gastrectomy is a little bit more simple. We're stapling the stomach, but not only are we stapling it, we're removing part of the stomach. So using a surgical stapler, we divide and remove a majority of the stomach. So instead of a big reservoir for food, it's more of a small tube meant to just pass food from point A to point B. So it's restrictive in the amount of calories that you can take in, but there's also some metabolic effects, including decrease in hunger hormone production and other changes. The gastric bypass is a little bit more involved. Not only do we separate the stomach into a smaller portion, but we reroute intestine to that small portion of stomach so that it works by both restricting caloric intake, but also it changes absorption of calories and nutrients and alters your gut hormone that way. Preparing for bariatric surgery, it's labor intensive. There's a lot that goes into it, and that's primarily because we want our patients to do well long term, not just with their surgery. So after a surgery, patients are typically admitted to the hospital overnight. You go home the next day. There's a very specific diet that you're following for the first several weeks after surgery. After a couple of months, patients are back in the gym. They're doing things that they weren't able to do before. Most of the weight loss comes off in the first year. After the first year, we are in more of a maintenance phase, but we do hope that we maintain those good habits, those lifestyle modifications that we discuss long term. But the goal is to give you a normal life, a better life that you would not have had otherwise. So success after bariatric surgery is measured in several ways. The most common that we like to talk about is weight, or a decrease in the body mass index. Most patients lose more than 75 to 80% of their excess weight after bariatric surgery. The gastric bypass may be a little better up front. Long term, the sleeve and the gastric bypass are very similar. What I think is more important, though, is your energy level, your functionality, your quality of life, your duration of life, all very, very important. But also for a lot of the major medical problems associated with obesity, those resolve also, or at least go into remission. Again, we're managing a chronic disease here.